Blepharitis occurs when there is an excessive amount of bacteria and Demodex on the eyelid margins, which causes inflammation of the eyelids and eye. Blephex is an in-office treatment for blepharitis. The true clinical name is microblepharoexfoliation. Blephex basically is a micro sponge that spins at high speed, which gently cleans the lid margins. Numbing drops are instilled into the lower eyelid. The vibration causes a tickling sensation. It does not hurt, but feels slightly uncomfortable as the eyelids are moved away from the eye. The tips spin in two directions. We clean in one direction for 30 seconds, then in the other. The eye is rinsed and inspected to make sure all the biofilm is gone. If some remains, we clean it again. Rinse again, and then we do a meibomian gland expression once the biofilm is completely removed. The cleaning only takes 5 to 8 minutes, but the expression takes a little longer. So plan to be in the office 45 minutes to an hour. After the procedure, your eyes will be mildly red and slightly sore for the next 24 hours. Please plan your day accordingly and do not wear eye makeup to this procedure. This procedure can be repeated every 3 to 6 months. However, I find most patients only need it every 2 years. This will all depend on how much biofilm an individual produces. Similar to cleaning teeth, some people need more cleaning and scaling every 3 months and others a lot less frequent. Demodex is a mite that lives on the lid margins. When we have an excessive amount, it is best to lower the numbers before we do an in-office cleaning. Lid and Lash Advanced is a concentrated tea tree wipe. It is applied to the lids at bed for 2 months. We rub it on the eyelashes and eyebrow with the eyes closed. We use one wipe, we flip it over and use the other side for the next eye. We fan the eyes for a minute before opening and then going to sleep. After finishing the box, we come into the office for a Blephex cleaning and a meibomian gland expression. Then ongoing lid care is done in the morning, and we should stay on the lid cleansers ongoing for at least 3 times a week. Pharmaceuticals for dry eye are Lotemax, Xiidra, and Restasis. Loterax is a steroid and used short term to reduce the inflammation on the surface of the eye. It can be used for up to a month, but preferably for only 2 weeks. As it is a steroid, it should not be used longer as it has risk for causing glaucoma, and when abused, cataracts. Now, short term, it really has very little risks. Okay. After doing the basic treatment of omega-3s, lid care, hot compresses, and eye drops, if your eyes are still basically irritated, then we prescribe a round of Lotemax. It is pulsed first week 4 times per day and the second week twice per day. So second week means that you would put it in like 12 hours apart, where the first week it would go in breakfast, lunch, dinner, bed. I find that 50% of my patients are good after doing 2 weeks of Lotemax as long as they continue with the basic dry eye treatment. But the other 50%, that flip side of the coin, will continue to have reoccurrences of irritation. Then a safe long-term solution would be Restasis or Xiidra. Please read the handouts I've created on these products. Now, Xiidra is a faster acting drug, still in an eye drop, but in a drug, okay, that works in 2 to 4 weeks, where Restasis takes 6 months to start working. Hence, we would generally prescribe Xiidra first. These drops generally sting, which decreases with time. You must try and stick it out. We get 3-week samples of Xiidra to try. If you're unable to tolerate Xiidra in that 3-week sample trial, we will generally prescribe Restasis. Remember, it takes 6 months to work. You have to persevere and stick it out. If the lid margins are clean, these products definitely work better. Hence, a BlephX once a year is a good idea when you're taking pharmaceuticals for your dry eye. Punctal plugs are used when patients are lacking the water component of the tear layer. We have 2 drains, one in the upper and lower eyelids, located towards your nose, that connect our eyes to the nasal throat cavity. Most of the tears drain out of the lower lid. If this drain is plugged, most of your moisture is retained on the eye surface. Yay! However, if there is inflammation on the eye and we plug the drain, more inflammation will remain on the eye, causing more irritation. Think of it as plugging up a dirty sink. The eye needs to be free of biofilm and blepharitis and have a negative MMP9 result. That is the inflammation or the inflammatory test done in the dry eye assessment. If that is all good, then punctal plugs can be inserted. There are 3 types of plugs: diagnostic, 4 to 6 months, semi-permanent, and permanent. Diagnostic plugs are instilled first, and they last from 4 to 7 days and dissolve. It's like a test run. If you experience excessive amount of watering and blurry vision, then plugs are not for you. If you find you're free of irritation and need your lubrication less, then plugs are a win. The next step would be to insert the semi-permanent collagen plugs that last from 4 to 6 months. I prefer these to the plastic permanent plugs as they have a lower risk for infection. But you will need to be in the clinic every 4 to 7 months to replace them. These work well when going in for surgery or just need a little help when waiting for pharma to work. After a year of doing this semi-permanent and blepharitis is not an issue, then we can consider the actual plastic permanent type. BlephX should be done yearly when using the permanent plugs to reduce the risk for infections.